we would just give an aspirin to somebody who has a stroke. Since the early 2000s, we can take catheters up into the brain, and since 2015, the trials have shown that actually you can basically reverse stroke symptoms. When we think about stroke, when we talk about stroke, for all intents and purposes, majority of the time, what the general public regards as a stroke is a condition where a blood clot occludes a blood vessel in the brain. It's a common cause of morbidity and mortality in the community. If you think about a heart attack being an occlusion of a blood vessel in the heart, a stroke is an occlusion of the blood vessel in the brain. Different from a heart attack, the blood clot that occludes the blood vessel in the brain oftentimes travels from a different part of the body and gets stuck in the blood vessel in the brain, thereby disrupting the blood flow to that part of the brain, which can give you all kinds of symptoms, including paralysis, loss of speech, inability to understand or to talk. And the swelling that occurs after a stroke on the brain as the brain succumbs from the lack of oxygen then can lead to death.
Managing stroke includes rapid imaging, including scans of the head. Certain subset of patients gets taken to an angiovascular suite where we do cerebrovascular studies, and it's basically an operating room with two independent machines that allow us to obtain three-dimensional imaging and watch blood flow or watch where the actual obstruction is, and we're able to go in with small little catheters and either deliver medicine or actually really suck out a clot and remove a blockage.
The way we decide which patients are candidates for mechanical thrombectomy or the surgery for stroke is based on the size of the vessel that is occluded. Usually patients will have very small vessels that we are not able to reach with the tools that we have today. And these are strokes that happen for different reasons. The strokes that we can treat with surgery are usually called the large vessel occlusion strokes. And these are vessels that we are able to reach with the catheters that we have nowadays and able to safely open the vessel and restore blood flow. And this is a time-sensitive decision, right? You will see the stroke symptoms, you'll call right away, because based on the timing, we can offer the patient treatments. Usually within 24 hours for the surgery and within 3 to 4.5 hours for what we call a thrombolytic, which is the medication that will burst the clot.
A type of stroke, which is called a hemorrhagic stroke, where a blood vessel bursts in the brain, and it can burst in different compartments in the brain. We talked about an aneurysm. An aneurysm is a bubble on a blood vessel where you can have bleeding. Or we can identify where the leakage point is and then occlude the leakage, so to speak, by injection of a drop of crazy glue or different types of so-called embolic materials.